good afternoon, for someone good morning, or maybe good evening. Thank you so much to joining us today for this webinar on how to get ready of healthcare data exchange of the future. So my name is Julia Munoz. I'm a partnership director at MedTech, and I'm delighted to be your host for today's webinar. Today we will share with you the most critical challenges in interoperability and data exchange issues. And we will share with you practical knowledge. We will share with you a real use case of data shifting. And also, of course, we will talk about new regulations, new laws that you should be prepared. You see, as digital health evolves, so we are connecting more data, more applications, more devices than ever before. And yet healthcare organizations are suffering from this chronic and very critical issues of data exchange and integration issues. So this webinar we are hosting together with Amaron. It's our first joint webinar to solve these problems and to give you practical strategies and share with you solutions to overcome these challenges. And we honored to welcome our guest speaker today, Maurice van Kerkhoven. Maurice,
Yes.
Can you maybe say something? Yeah.
Yes, of course.
Maurice is co-founder of Amaron, Belgium leading healthcare interoperability company. And she's founding Amaron in 2009, together with Tom de Kaluve. By the way, Tom is also with us today. Maurice has helped grow the company from a startup into a national leader in healthcare IT. And by now, Amaron implemented connections with almost 90% of all systems used there. Company also operates in Netherlands and France, and now entering to the Spanish market thanks to our recent partnership with Meditecs. So let me also say some words and talk a little bit about our partnership, because I believe it's one of the true examples of the power of collaboration. So Meditecs, like Amaron, was founded in 2009, and also by two co-founders, Antonio Monzó, who is also together with us, and Pedro Torres. Also, Pedro is here and will help us to moderate this webinar. At Meditecs, we specialize in integration and healthcare interoperability, processing now more than 100 million patient records each month. And with more than 150 projects completed across Europe and Asia, we helped about 100 hospitals to solve their interoperability challenges. So I would like to say that when we first met the Amaron team, we saw how much we had in common, not just the year of the foundation, but also our shared mission, our passion, and common DNA, and our commitment to improve interoperability around the world for better patient care. That's why we joined our forces to drive digital transformation across Europe and the Spanish market as well, to deliver advanced and cutting-edge FHIR-based solutions for healthcare organizations, for MedTech companies, AI solutions companies who is working with the healthcare organizations, in order to improve this situation and improve interoperability. So maybe with this, I would start to share my screen with you. Let me share it. And please let me know if you can see my screen when I will share. Okay.
Yes, Julia.
Just let
see
me
your
know.
screen.
Okay. Okay, thank you. Thank you. So yeah, it's our first webinar, and thank you again to attend it, to be with us today. As our webinar saying about data exchange, we also would like to make this session an opportunity to everyone for the knowledge exchange. So please be free to use Q&A session, to use a chat, to share your thoughts, to ask your questions, to also connect with other participants, because our goal today is to make this webinar as interactive, as beneficial as possible. We have today quite exciting agenda. We will have the presentation, and after this presentation, we also will have Q&A. So in case we will, and also we have here two teams, by the way, Amaron and Meditecs will help us to answer your questions. But if we cannot do it during the presentations, don't worry, we will try to answer them in Q&A. And also, if you will come up with some questions afterwards, after the webinar, also please be free to contact us, to email us. I will share my contacts in the chat afterwards. And before we start, also last note, I would like to remind that we are recording this webinar. So in case you will need to leave earlier or you would like to rewatch it, we will email everyone with the link to webinar recordings. Okay, so with this saying, I hope that everyone is ready. So let's get started. Let's make this webinar, as I said before, as beneficial as possible. And please join me in welcoming our guest speaker, Maurice. Maurice, stage is yours. Please say something.
Yes, thank
So we
you.
can
Thank you, Julia. I hope you hear me well. Julia,
And
you hear me?
yes,
Yeah.
I can hear
That's
you.
the first. That's the first check. So welcome, everybody. Thank you. I'm happy to be here, and I'm also happy with the introduction that Julia gave. Of course, maybe a little step back. Yeah, if a little explanation still about Amaron. As Julia mentioned, we founded in 2009. Myself, Maurice, and Tom founded Amaron. But actually, we go a long way back from the 90s. We started our career in the early 90s, and in the radiology domain. And I would dare to say that our DNA for interoperability, for connectivity, comes actually initially out of that radiology domain, because many people will know it's a very technical-minded department within the hospital or within the healthcare. They have a lot of systems to connect to, and they have imaging devices and so on to connect to. The prescription and so on, and the information needs to be delivered on time. The reports need to flow back and so on. So in the early days, in the 90s, interoperability, or what we then called connectivity, was already a very important topic. And this kind of, I would say, after 15 years in that domain, this kind of formed us, Amaron, the people from Amaron, to really focus on that part in the healthcare, because we understood that interoperability would be key. And if you look at all the messages and all the information around healthcare, about data exchange and so on, we see that we made the right choice. which is also important, and that we understood, also coming from that radiology domain, is the use of standards is of very high importance. Using standards to exchange information gives us a step ahead to already understand some of the concepts and so on that we are talking about. So we are quite present also in organizations like IHE, like HL7 in Belgium, but also international, to help promote the use of standards, not only for the vendors, but also towards, I would say, the healthcare providers to be open and keen to use those standards. Okay, let's go to the next slide. This is enough for the introduction, I think. Amaron, as Julia said, has some, the name comes from some Italian product, so I had to put into the slide also maybe the most famous Italian product, which is spaghetti. But actually, I want to talk about the return on investment of, you know, the spaghetti situation that we had in the past, but still today in most of the hospitals, where, you know, a hospital has over 150 at least, or 200 in some cases, 200 or more software applications. You have the radiology information system, you have a PACS, an imaging system, you have scheduling, you have nursing, you have the lab, oncology, neurology, even cardiology. They all might have their own applications. And, you know, interoperability and connectivity was mainly focused on making sure that all those different systems would have the same data and the same information available. They all need to be in sync on the patient data, on the latest appointment, or on the latest lab result. And that was, to a big extent, what connectivity and interoperability was about, let's say, in the 90s and also in the early years 2000. But that has changed, of course. That has changed. So we can go on to the next slide. The focus that we want to put as Amaron, but also as Meditecs, is to streamline, actually, as much as possible, the data liquidity. That's the new name that is coming up. Is to the data needs to flow, and it needs not only to flow within the walls of a healthcare enterprise or a healthcare organization, but it also needs to flow outside to the government, to other hospitals, and so on, towards the patient, towards the general practitioners. And as an Amaron, our vision or our karma or our direction is really to try to optimize this as much as possible by offering knowledge and by offering our solutions to those healthcare organizations. So, indeed, Julia, you want to ask a question?
Of course. My question is, what are key interoperability and data exchange challenges in healthcare you see talking to your customers, working with the hospitals in Belgium, in France, and Netherlands, other countries? What are the common challenges you see?
You can go to the next slide. If we look at what the demands of today, if you look at what's happening today, we all hear the big words, we all hear the buzz and the hypes around. We need big data. We want to have advanced analytics. The patient needs to be more involved. You want what is called the patient engagement, and that's certainly for the more younger patients. I would say we have the patient-centric approach. We need to be sure that we have integrated care, that, you know, all that everything really is oriented towards taking care of the patient, and on that all the different stakeholders and all the different providers of healthcare are involved. There's the focus on value-based care, making sure that you know the care that is being provided to a patient that is really helpful and of value to a patient. So we have all those, you know, big goals, those big driving forces that we want to that we want to include into the healthcare, and there is so much data that is required and that we are now being focused on is that it becomes really cumbersome for healthcare organizations to know and to understand how to deal with it, because we have a lot of things to take into account. There are regulations that are important. There's more focus on GDPR and so on. So those are all now the challenges. This is the future that is ahead of us, and that we as a vendor need to provide, and we want to provide solutions for, but also as a healthcare provider, you need to take into account, and we need to try to guide them as much as possible as a vendor organization into interoperability. Yes, you can go to the next slide, Julia. So we have all those, you have all those important things that are happening, and then I'm not even talking about the fact that we come from one of the largest congresses, HIMSS, and the word AI is everywhere. Everywhere where you look at in any booth, you see that there is AI mentioned. We want to improve healthcare. We want to take the burden of the healthcare providers who are too much busy with administrative tasks and so on, and we want to help them with AI. And the new word, and you can write it down, is now the agentic AI. We want to provide AI agents to really finish off certain tasks, administrative tasks or cumbersome tasks that can easily be done by the computer, by an algorithm, by AI, and so help the providers to focus on the care of the patient. There's this one side, of course. The other side is, how do you do it? How do you try to achieve this? Because there's so many data spread everywhere, and let's be honest, most of the data is unstructured data. There's a lot of text-based information, a lot of PDFs that are residing, and there's little of structured data. On top of that, we need to deal with the regulations, with the laws that are being made. There is the privacy, and certainly in Europe, which is quite important. There is the new legislations around the European health data space, where there will be more and more specifications and laws and rules on how to deal and how to exchange information. And next to that, there is, of course, the request of data to be exchanged to a lot of systems and to a lot of parties that play a role in the care of a patient. For the primary use, on the one side, to treat the patient in a better way, but also for secondary use, for research, for population health management, to guide and to steer studies. So these are all the challenges that we and healthcare providers are changing, and hospital organizations need to take into account and need to find their way through the bush of trees, if you will. It's a complex effort to try to achieve it, and even to try to understand it.
Oh.
Yeah, we need to move forward.
Yeah. Okay, and now we are with the second question. How to solve those challenges, and why do we need to adopt new data exchange standards? And the most important question, why is FHIR adoption crucial for us? Why is the advanced and the standard of the future?
Yes. So why do we need a new standard? Maybe I mean, this is not a FHIR training, I assume, but I will give some basic explanation on what is FHIR. FHIR is actually a newer standard of HL7. We had the HL7 V2, which is a text-based standard, message-based standard being used by, let's say, 95% of all the systems available and in production today. We had the HL7 V3, which was a certain effort to put more structure and to have a more service-based and API-based approach, but it was too complex. And so there is now FHIR, Fast Healthcare Interoperability Resources, which is the new standard being developed since 2012, 2014, and is now pretty much in use and is now pretty much widespread. It's a standard that is based on on the building blocks, on the healthcare information building blocks, like a patient is a building block, an allergy is an information block, observations, and so on. So all the information, all the healthcare information is being divided into all separate pieces of granular information, and that makes it easier to query certain information. I want to have the latest appointment of this patient, or I want to have the latest lab result of this patient. It is now much more easier because you can have directly access to that detailed level of information, which was previously in the, I would say, in the actual HL7 standard, is much more difficult to achieve. It's also a newer technology. It's a web-based technology. Let's face it, you know, the new young guys and girls that graduate from school, they use different technologies now. They use REST-based technology, REST-based tools to develop app application, and for sure apps and so on, and web technology is now being used to show and to display information. And you have a few examples here of a certain request. You see the different HTTPS requests of give me information about, give me all the patients that you have, or give me the patient with this specific identifier, or give me the patient with this first name and this last name, and so on. So you can really, on a granular level, you can request information to a system that is having and that is storing medical information. And this, I would say, previously or today with HL7v2 is much more difficult to have that granular access to very specific information. Because if you today, if you look at all the applications that you have in a hospital, everybody is duplicating information, right? Every RIS system or every PAC system or lab or an EMR system is just duplicating all the information in separate databases to have access to certain information. With the new FHIR standard, it's actually possible to just query online for one single piece of information and being able to show it in your app or in your web page or in your app application without the need of storing all that data first into your database and to be able to pull it up and show it on screen. So that's an enormous, I would say, step forward to the new standard that can be used. Next to that, of course, there's, I mean, it's unbelievable how many people and organizations are now focusing on this new FHIR standard. You have governments, you have organizations that are so involved in helping to set steps forward to actually make data widely available. And that was not the case with the previous, I would say, HL7 standard. We didn't have the government and so on specifying data sets and care sets which are required to determine allergy information and so on about the patient. We pretty much had to find our way ourselves and determine how a certain system would translate that type of information into a certain message format. Now with FHIR, everybody is really jumping on it and is making specifications and regulations and profiles and so on how to exchange that information. So it's really becoming an open book to do data exchange and to understand the data inside.
I have a question, Maurice.
Yep.
Maybe let me try if I can ask our participants also how they are familiar with FHIR.
Yeah,
maybe
sure.
I'm not sure if I can do it sharing the presentation. Let me stop share for the moment. Okay. Do you see the questions on your screens? Please say something in the chat. Just confirm that you can see the questions about the FHIR adoption. I don't see any comment. No. You cannot. Okay, let me check it again. Let's check it now. Do you see it now? Okay, perfect. So I welcome you to share with us also a little, we want to know you better also, and we want to know how are you familiar with FHIR standard? Do you use it in your organization? Maybe you just thinking about to use it in the near future, or maybe you are a professional. Yeah, thank you so much. Yeah, we will give more time to everyone to answer. Okay. By now, the first results that I see that we don't have no one here at webinar who are not familiar with FHIR standard. It's amazing result.
Great.
It's amazing to see. Yeah. Everyone is familiar. Some of our participants heard about FHIR, but not exactly sure what is this. So I think this webinar will help you to understand it better. And we have almost 67% of our attendees who are using right now FHIR standard in their organization. And this is very great result. It's very nice. Yeah, 70%. Okay.
Okay. It proves
Just
that it is very widespread. So that's a good yeah.
Yeah. Let me know if someone need a little bit time to answer. If no, okay. I will finish the poll. But yeah, it's very nice to know that a lot of people and organizations already know about the standard, use it, or will think about to use it in the very near future. Thank you so much. Thank you all of you to participate. I will share the results now. Do you see now on your screen the results? Let me know, please.
I don't see them.
You don't know. Okay. So we will share it afterwards. I think it's some technical issue here, but anyway, we will share with you because it's great to see how many professionals are here today with us with this in this webinar. Okay, let's jump to the next question.
Yeah.
I will continue to share slides. One second. Sure. Do you see my screen now?
It's not yet shared.
Not yet shared. Okay. Give me 1 second, please. Okay, we are here now.
Okay.
Here we go.
Yeah.
Yeah. So the next question. We are in the middle, I would say, of the European Health Data Space project. And we have quite tough deadline, but I'm not sure that everyone is prepared for this. But actually, we should be prepared for this. Could you please explain what is this about? What are timelines we have, and how to be sure that we follow all the mandatory and all the necessary standards and frameworks to comply?
Yes, with pleasure. So we know or we don't know that already in the US and North America, the use of FHIR has been taken into account in several laws. Actually, the Patriot Act and so on was included. The use of FHIR, the Non-Information Blocking Act included FHIR. So this is also one of the reasons why in North America they are, I would say, in advance of us, of European or Europe or European countries, because it's already a couple of years, I think, since 2018 that it's mandatory to use FHIR to exchange information with payers, with the patients, and so on in the United States. And now Europe is also focusing on this topic. It took more time for Europe, of course, because we are so many countries, as we know, and we need to agree together. But we also have, I would say, more stricter rules on the privacy and so on. So the European health data space is actually a European effort. It's a framework for secured and standardized access to health data amongst the European member states. The purpose is to empower the patients. It's to support the healthcare providers. It's also the purpose to boost research and innovation and health population and analysis and so on cross-border. Of course, one of the main goals is also that to allow a patient traveling from one country to another to have access to its medical record. And the whole GDPR part, the whole privacy part, is also to ensure the data protection and security. So the European health data space has made up a certain set of requirements, a certain set of rules, and it's actually going in effect. I mean, the whole publication was just released, officially published in March 2025, and it's all part of the digital strategy of Europe and its member states. So as I mentioned, it's now published, it's now available, so you can go for it. We can maybe after the webinar we can provide some extra information where you can find the official publication. Actually, it's quite readable, quite understandable. The first phase of implementation is already in March 2027. One of the most, I would say, the important impacted systems is, of course, the EHR, the electronic health record, that by March 2029 should be able to exchange patient summaries, prescriptions, and medication dispensations. By March 29 to exchange it in the international format. It's called the format is the I would say the preferred name or the easy name that it's being used. The more difficult name for the same term is actually the EHR XF the format, the electronic healthcare record exchange format that should be supported by the EHRs as mentioned by 2009 to exchange information. And by 2031, actually, these systems, EHR systems, should also support the exchange of imaging data, medical test results, and so on. In 2029, already the initial steps for secondary usage should be supported. And by 2031, also the use to cover also genomic data, wellness app data, and so on should be supported by all, I would say, systems and so on that are able to expose that data and are able to be requested for that type of information. So they look far away, but actually, if you look at the state today, how EHRs and hospitals and healthcare providers, if you look at the systems and the data they are able to expose, then 2027 and 2029 are really nearby. If you see what still needs to be achieved and to be accomplished to be able to comply with these European regulations. Of course, there is always some translation per member state. There are some specifics that can always be determined on the country level, and countries all needed to have a health data agency available to, first of all, to organize the work package, I would say, and making the publicity and the information exchange within its own country, and to report back to the European health data space on where they are, where they have issues or problems, so that this these rules can really take effect from 2027 and 2029 on.
Yeah, it seems like far away from now, but you are right. With the work that should be done before, with all the necessary changes and the standard adoption, it seems like we should be we should start now to get prepared.
Yeah,
right.
Just to give an example, in the specifics, in the whole regulation part, healthcare providers and of course you would look at the bigger hospitals, but even smaller hospitals or lab organizations will, if requested for a certain piece of information for a certain cohort or for a certain group of patients, they should be able to respond within 3 months with the requested or the required data. So in this way, it will be possible to exchange healthcare information amongst countries on a European level. Yes, it should be perfectly feasible to request from several geographic locations data to do research or analysis on, or in the case of a pandemic and so on, to be able to have really access to the information that was lacking, I would say, in 2021 and 2022 during COVID, of course.
Well, it seems like a lot of work to do, but do we have some tools, solutions that can help us, can help healthcare organizations to go faster and with less efforts in order to adopt this new, let's say, framework and standards? Could you share with us also?
Yes. With pleasure, with pleasure. We are focusing on helping the healthcare organizations to be able to respond to these requirements and to able to deal with the new way to have and the new rules to do data exchange and to respond to data requests. And for this, we have been developing several tools, and one of them, I would say the most important one, the key one, is of course the FHIR Station, that will allow healthcare organizations to manage and to really have a view on the data exchange and the new ways to do the data exchange and the FHIR communications that will be required in today and in the near future and in the far future. And you can go to the next slide, please. As we mentioned, we have all the different users of information for the primary use, the direct care for the patient. We didn't talk too much about it, but also to the whole ecosystems of AI, of dealing with data of patients in general. We want to be able to control, of course, which data we deliver there and which level of security and privacy and so on that we want to put on that. There is the operational use to do benchmarking and so on. And of course, as we mentioned, clinical trials, the secondary use, the research, those are all consumers of data on the one side. And then on the other side, we have the data itself. We move to the next slide, where we have all kinds of sources of information. Could be the EMR, could be the HIS system, could be information coming from home care, specific devices that are, because we are now more and more doing a follow-up of the patient at home, where we are also generating results. Patients have their own devices, enter information in their smartphones, or have access to certain, or to provide access to certain information in smartphones or smartwatches and so on. So there are all kinds of data I would say, repositories. That's the way we refer to it. If we talk about the FHIR world, there will be so many repositories or information that we will need to have under control, and we want to make sure that if we want to expose that information, that we have a good control on it and a good level of management to make sure we do it in the right way. And then if we move to the next slide, we are putting in the midst, I would say, in the middle of on the one side, the requesters on information, and on the other side, all the sources of healthcare data that we will have today and will have many more in the future. We will put a layer, what is called FHIR Station, maybe one back.
So it's, yeah. Sorry, my fault. Okay.
Yes, FHIR Station, which will allow the governance organization or the IT organization, depending on which type of healthcare provider or organization you are, to have control on the exchange of that data, to be able to control all the FHIR requests that are coming in, and to be able to put rules on which data can be accessed and in which way it will be exposed to the requesters of data. In some cases, you will need de-identification or pseudonymization if you talk to an AI algorithm, for instance, or you want de-identification if you want to send it for a clinical trial. If you have a strong governance in your organization to allow certain projects to have access to information, there's a whole governance workflow also included, and which is quite important, will be the logging and auditing on every event, on every piece of information that will be exposed to an external party. Because one of the requirements also in HDS is that a patient will at any time will have the ability to request, to whom did you expose my information, or they even can ask to a healthcare organization to stop exposing certain information. So with FHIR Station, we want to really provide the tools to the healthcare organization to take control and to really have a view on all that, on all those data exchange requests and all those data access points, to make sure that you have the hands, that you have your own management in your hands, and data can be also inserted through the same FHIR Station. You could have legacy systems that still spit out HL7v2, or even could be CSV, comma separated data sets. We can also store that information into a repository and make sure that it's curated and really it has a high level of integrity, so you are not, I would say, spoiling or turning your repository of information into garbage. So you have a good control of all the information that is in there, and you don't do endless duplication of patient data. So this is our, I would say, one of our answers towards taking control and being sure that you're able to respond to the more and more increasing level of data requests and data exchange requests that we will have today and in the future.
Maurice, it looks very impressive, and also for us it looks very impressive because we know that a lot of hospitals, and I mentioned it in the beginning in the introduction, more than let me say correctly, about 90% of the hospitals in Belgium already use your FHIR Station to control and to exchange the data, isn't it?
Yes, correct.
So it's amazing, and actually I think it's a good approach to exchange best practices and to exchange solutions that already proved the efficiency and helped a lot of healthcare organizations in one of a European country, and we can now bring this solution to more countries, to France, to Spain, to Germany, etc., and to share with you this solution that already proved its efficiency. That's why actually we are delighted to share with you today this this knowledge, these best practices. And the best way to share with you how your healthcare organization can benefit from this solution from FHIR Station, I think it's to share a real use case. And we prepare it also for you. So let's see, because we have few minutes before, actually we have 10 minutes, but I would like maybe briefly just to share the use case, because it's quite impressive results that you achieved. Yeah.
Okay. Yes.
And then I hope we will have some few minutes for Q&A. Let me just, before we start, we have one of the question already. Okay. But let's have a look, because I think it's very interesting for our participants and audience on a real world use case, and then we can leave a little bit time for questions.
Okay. Maybe go to the next slide with the real world. It's called COSO. Maybe a little bit of background information. COSO it's actually a regional network. It's a regional data exchange network, pretty much based on a very local API format, but the participation is massive. We have more than 37 hospitals that are being part of that, nursing homes, laboratories, and so on. So there are more than 190 healthcare organizations, small and bigger, that are really connected to the COSO network. It's an app, it's an application that shows you the medical information, but it's also a backend data exchange platform that allows you to pull in the data as well. If you look at the usage of the COSO regional network providing that data, we have more than 1 million unique caregivers and patients that are really consulting the data. There are 4.5 million of requests per month, and okay, the money it saves per year, I don't think we need to go into these details. These are, of course, certain calculations and impressions, but the fact is that the data really remains at the source. I think that's an important aspect of this network. And you can basically, in Belgium, you can pull up wherever the patient arrives. You can pull up through this network. It's a meta hub kind of infrastructure, and you can pull up almost any result from a patient, no matter with which GP or no matter in which hospital you end up, of course, also taking into account the patient consent. So for this regional network, we can go on to the next slide. We have within this regional network project, we have a small new future project which is called Shift. And it's a completely FHIR-oriented project. And as I mentioned, currently it's running on a very local data format with a local SOAP for the technical people, SOAP interface, which is you need VPNs. It's less secure and so on than the way FHIR and all the REST services have been designed. But actually, we have now 5 hospitals chosen from within the network that will start exchanging allergy information and historic problem information about the patient in real time. So the purpose is really to use the new data exchange format within the regional network. Yeah, you can go to the next slide. Yes, so it's quite ambitious because, as mentioned previously, and the most of the data exchanges that are happening are text-based, but in this case, we really want to make sure that we can have access, because FHIR is designed for that, to have access to the structured data. So one of the challenges and the hurdles they need to they needed to work on is to actually SNOMEDize all the allergy information and so on, and get in every hospital agree on which codes to use and so on. I think many people working at healthcare providers will understand what I'm talking about. It's not so easy, of course, to get everybody on the same page for certain codes to use and so on, because SNOMED it's a very broad terminology. But it was also very ambitious around the integration, because every hospital had its own EMR. The whole interaction is also based on the FHIR data sets that have been defined on a national level. They were not all finished yet, but today we can say that this project is now live and running and are using the data sets and the care sets that have been defined within FHIR by the Belgian healthcare agency. The good thing is, I think it's a distributed FHIR architecture, so still all the data remains in every hospital, so every hospital can decide upon themselves which data they want to make available, which security they want to apply to it, so every hospital keeps the control on their data. So yeah, I think certainly the people are very enthusiastic within that project, and it's really live as we speak, and it's really running on the new HDS stipulations and regulations, if you will, because we're exactly using the same data formats and the same data technology that is being specified within the HDS regulation.
I was on mute.
Yes,
Maurice,
probably. Yeah, Julia.
It's a perfect example of how actually healthcare organization can move and make this digital transformation and shift and enhance the exchange of the data in the different dimensions. My question is, let's imagine there is a hospital in Spain that wants to achieve the same results. What they should do in this case?
Yes, we can. Yeah,
Yeah,
first
I
of all,
think it's actually a question to both of us.
yes,
So
talk to us. I would say talk to us, and we can try to understand their situation, and they can make use of our knowledge and expertise that we both have in this domain, of course.
Yeah. Indeed, actually, this is the main reason why we're here today with you. As I said in the introduction, so now this FHIR Station solution, as well as all portfolio of the Amaron FHIR-based solutions, Firebox and other solutions, now are available for Spanish healthcare organizations through the MedTechs. Thanks to our recent partnership, and we are absolutely happy to provide with our knowledge, our expertise combined with many years and proved expertise and solutions of Amaron team. And of course, in this case, you will have, let's say, double efforts from both of our teams, our support, and all, let's say, no barriers in language and regulations, local standards that healthcare organizations, hospitals should follow and be compliant. And how to get started with this? This is the question. So what do you think? How healthcare organization can get started with FHIR right now? Maurice.
Yes, I mean, first of all, you need to build up the expertise. It's it's a specific knowledge. We all know the interoperability team or the connectivity team, or how you call it I mean, they're all busy, and it's not that easy to get all that knowledge together and know which direction to go to. So you can, talk to us. We're an experienced partner. This is what we do. This is what we do for many hospitals, for many healthcare providers, and we also try to make it easier for you. As you've seen with the FHIR Station, a lot of FHIR server solutions need a lot of programming to do certain configurations and so on. Our focus is to really provide a solution where you have an intuitive user interface, and for the basic rule sets and so on and security that you want to put in, it's actually through the user interface. It's what you see is what you get configuration to be able to achieve that. So I think that's important, to make it easier for the IT staff to be able to adhere to that, and to be able to use those tools and start going with that type of new type of data exchange. Of course, compliant. You comply with eHealth and data privacy if you use those new means to exchange data. You want to keep it as simple as possible. You want to avoid point-to-point chaos or point-to-point connections, and get started now with FHIR to have your experiences. I mean, it's in any way, it's future-proof. It's coming along. It's coming there. So you shouldn't wait. You should get started just to be ready for the various dates that are in front of us and coming up to us. So, I would almost say without any further delay, and I see that already 67%, or I hear that already 67% of the, here the listeners in the webinar are busy on FHIR. Well, yeah, that's already that's already a good result, but it needs to improve. We all should start, and we all should get ready for what's coming along, and to be sure that we can deliver, the new level of healthcare.
And close the gap that we have right now,
Indeed.
right?
Yes,
Yeah.
indeed. Close the gap. Close the gap of information exchange, of access to data, for anybody.
I really like this slide with the scheme of the metro stations. Actually, it's kind of it's remind me actually the structure of our healthcare ecosystem, and it's very important to provide this seamless integration and seamless data flow and data exchange between all of the parts of this ecosystem. And we're happy also to invite you to talk to us if you are already using FHIR, or you're thinking about this. So since we are just starting our partnership, we provide and we offer start with a pilot project, and when you are confident, you can go live. And if you're interested, please, I will share also my contact and the contact of Maurice afterwards in the webinar, and we will send you email how to get started, how to start. We also will provide training on FHIR. It will be available in English with Amaron team and Spanish with MedTech team. So if you're interested in the training, just contact us for this. And now I would like we almost don't have enough time, but I'd like to give time for our attendees if you have your questions. So please, we're a little bit out of the time, but if you have questions, please ask us, and let's start the Q&A. I will stop to share my screen and check Q&A. Okay, we have one question. Oh, we have more questions. No? They are answered. Tom, thank you so much. You just answered the last question, but maybe you can answer it verbally also to all the attendees. How can developing countries like the Philippines adopt interoperability standards like FHIR? Very interesting question. Actually, yeah, we were talking about European countries, but here today with us, people from different corners of the world. So, could you maybe, Maurice, share your experience? Because I know also you've been in US and on HIMSS 2025 last week. Of course, US is much more advanced in this case, but if we are talking about the developing countries.
Yes, of course, that's a very good question. It's important to understand already which systems are available in those countries. So you need first of all, you need to know we don't generate medical information, so we need to have access to systems that are storing and keeping medical patient information. And so it's important to know which EHR systems are present there, and other applications that would be present, like a radiology information or another, and then understand which vendors do you have there, and see what kind of data exchange they already support. Do they have HL7 v2? For example, if they're still on HL7 v2, there are ways to transform that information towards the FHIR standard. So from that perspective, you don't need to be on the latest and greatest, but it's important to understand which data repositories or which information is already present. And it always helps to know which kind of systems from the US or from, are they home built or are there in international systems? And from there, we can start to understand, all right, we know that, I don't know, if GE is there or it's an EPR from Cerner or from another vendor, to understand already what the capabilities are to have access to the data, and to then start looking at what kind of project do we want to start up. Do we want to provide access to patients? Is it data exchange between hospitals? What do we want to achieve? I think that's the first question I would ask if we would be in the Philippines and how can we get started on FHIR? Well, there's a lot of information already available. You can even directly address HL7 and FHIR, and then have somebody like a Diego Kaminsker coming along and explaining you. I mean, HL7 has those profiles, has those resources to come and talk to healthcare governments in a country and explain what FHIR is and how you should proceed to introduce it in your country.
Yeah, but anyway, it looks like it's our future, or I would say even our present. And before or after, you should to adopt this standard in order to be not only compliant, but also to be effective and to be competitive and to be effective and to follow those standards that almost all the world is going to use very soon or using already. We are a little bit out of the time, but I'd like to give the opportunity our participants, please, if you have more questions, and you can stay with us a little bit more, you are welcome. Let me know, please, if you have question, type it or raise your hand in case you have this question. Okay, I don't see more questions. We have questions that we answered during the presentation. Thank you for those questions. But again, as I said in the beginning, we are welcoming you to contact us, to chat with us. we will be happy to help to get started with FHIR adoption with the all the products and solutions. And again, thank you so much to be with us today. Thank you to all our speakers and team members who were helping us today. And of course, thank you so much, Maurice. Thank you, Tom. I would say that we will be waiting for the next session, and it will be a next session. By the way, we're planning to do it in Spanish for whom is interesting. And again, we will be sending you a link with the webinar recordings if you want to rewatch it. And thank you again so much. Yeah. Thank you. Thank you. We see each other next time on the next webinar. And please start now with the FHIR adoption. This is the time.
Thank you, Julia. Thank you, everybody, for being present and for listening to us. Hope to talk to you in the future.
Bye-bye. Thank you.
Bye-bye.
Have a nice evening, day. Bye-bye.